Greetings, I'm Dr. Max Gomez at the 5th International Vatican Conference, and I am joined today by David Rhew. David, thank you for joining us today and giving us some of your insights, but let's start with kind of a general question here before we dive into your specifics. A lot of these conferences that we all go to tend to be relatively focused, siloed, if you will, focused on a disease, an organ, an issue. This Vatican conference is very different. What do you think is the value behind it?
You're absolutely right. Much of what we oftentimes focus on is our specialty or our area of interest. It could be healthcare, it could be technology, it could be some other aspect. But what we're recognizing is with the Vatican conference, we need to work together across multiple different organizations, channels, finding ways that we can collaborate in ways that we've never even thought of. Much of care today, and we've seen it highlighted with the pandemic, is about communication and communicating with individuals, people, understanding the issues that face them, the science and the technology, all brought together in an environment that allows us to be not only collaborative, but an ability for us to learn together and to advance the areas that are so important as we plan to battle these pandemics and tackle some of the biggest problems we face today.
So, David, when we say science and healthcare, people kind of immediately go to new drugs, cell therapies, fancier treatments and equipment, but you're really focused on using technology really in a very different way. Tell me about AI, artificial intelligence, and how you feel that is really going to help benefit and deliver healthcare, particularly to underserved parts of the world.
So one of the things that we recognize is that artificial intelligence allows us to be able to become much more efficient in what we typically do. So while it may take one individual a certain amount of effort to be able to apply our own knowledge, we can then extend care by using these technologies. The example that I provided with the physician in Mount Sinai communicating directly with the surgeon in Uganda was a great example, because what we were able to do with artificial intelligence, with the technology, is not only be able to create a video visit, but also guide the individual during a procedure. This is not something that can be done without having people normally sitting right next to each other. But with artificial intelligence and the technologies, we can recreate these worlds that allow us to be able to then reimagine the future.
In a sense, this AI that you're talking about is kind of a technological way to aggregate the wisdom of the commons. We can bring knowledge from so many disparate areas together so that everybody can benefit from it.
Absolutely. Much of what we find is that there's just too much information out there for one individual to be able to synthesize and then apply it real time. But with computers, we can do that in a very scalable way that allows us to be able to not only help on an individual basis, but we can improve the standard of care across communities.
David, many of my contemporaries, colleagues, physicians are really burning out. They're done. And they're leaving the profession, sadly enough, because they're really terrific people. How can technology impact that issue?
Absolutely. Unfortunately, not all healthcare is about taking care of patients. A lot of it has to do with the administrative burdens of entering documentation into electronic health records, doing billing. What we can do is we can apply artificial intelligence to remove a lot of what I'll refer to as the waste in the system. And that's an extraordinary opportunity, because by doing so, we can enable clinicians to become much more effective and then spend time with the patients. That's going to be not only good for the clinicians, but good for patient care.
And that's what I feel is physicians really got into it, most of them, was to have that patient to patient, patient to doctor interaction. And that will actually benefit that?
Absolutely. We've actually seen in several of the studies where we've deployed the ambient clinical intelligence, which is what I shared in the video, essentially allowing a conversation between a doctor and a clinician to be captured and behind the scenes brought into the medical record. That's the type of effort that's going to allow doctors and patients to be able to focus on each other and not have to worry about, oh, what type of information do I need to now enter into a different database? So that's going to change the way that doctors interface, allow us to have more time with patients, and then also allow us to be able to extend care to areas that we've not even thought of before, such as having nurses, pharmacists, other clinicians be able to leverage this technology and ultimately change the way that all healthcare is provided.
David Rhew, thank you for your insights and a glimpse into what I hope is a more hopeful future for healthcare for all of us around the world. Thank you.
Thank you.